I'm Jerry Hesch. I'm teaching a whole body workshop in New York. And our victim on the table is Dara. And her presentation is one of a left pelvic side glide fixation. Now, if I come to the outside of the right pelvis, I make little fists and I push, I can push her pelvis to the left. And then it stops moving. That's called taking up the slack. And then I impart an additional force and I get a little spring mobility. So it'll spring and bounce back. Okay, so one more time. We take up the slack, we move it to where there's a natural stop point. And now I thrust it and it goes a little further in that direction and it bounces right back. When we come test her on the left side, going left to right, there's minimal motion and the slack is immediately taken up. So with the same reasonable amount of force, it feels like I'm trying to move a brick wall. And if I double that force, there's no give. I'm tripling that force and there's no movement. So it's a restriction in the hips and of the whole pelvis moving. It's a restriction in the SI joint as far as we know, and it's a restriction in the lumbar spine as well. Now, what made you think you might have this pattern?
Hamstring strain that
You-
caused.
You have a hamstring strain on the
Right side.
on the right side. Interesting. Let me have you lay on your left side. And then you're going to bring this hip into neutral, a little bit extension, good, and bring it up. And I want you to show me how strong you are. At the count of 3, give me everything you got. Okay, 1, 2, 3, go. And that's so easy for me to break. Lie on your other side. So I'm testing her abductor strength. Hip abductor. Good, lift this one up. On the count of 3, give me everything you got. 1, 2, 3, go. I can't break it. So there's a distinct inhibition there. And so what we want to accomplish with positioning is to get your pelvis to shift from the left to the right. So what we're going to do is have you lay on your left side on top of a stack of pillows. Can I have those 3 pillows under there, please? Thank you. So let's fold this one in half, and let's put that one on top of there, and lay on your side, under the pelvis, and then take your hip into a little bit of extension, both hips into extension. You go a little further back. You okay there? You feel a little bit of a stretch? Okay? So typically we would do this for 5 minutes. And let's get you out of there. I want to show the compensation. Let's take the pillows out. Let's have you lie on your back, please. Let me take this away. So if her pelvis is shifted over to the left, which way do you think her head is going to shift? To the right. So here I'm taking her occiput and I'm shearing it over to the left. And she has easy glide. And now I'm shearing her head to the right and it's blocked. How much force am I using? How much?
A good amount of force.
A good amount of force, and I cannot get you past neutral. But when I use a small force going to the left, I shift her chin over, her nose over, I glide it over to the left by at least an inch of movement, and there's no movement to the right. So the compensation for the pelvic glide is in her upper cervical. I could bang away at her upper cervical and get nowhere. Or I could treat the cause, and the cause is the pelvic side glide. And this is not in any book. I haven't read about this in any textbook. It's a pattern I stumbled on with trial and error. So sit up, And then you're gonna lay with your the left side of the pelvis on top of these pillows. Good? And I'll give you a pillow for your head. Put both hips into extension so the straight line goes from the shoulder, through the pelvis, through the knee, and lift your head up. Here's a pillow. So let's get a little more hip extension. Good, you okay there? So I would do this stretch for 5 minutes. And I don't know if we want to stop filming and come back to it. Let's do that. Let's do part 1 and part 2. Okay, somebody get